Medicare Part D prescription drug benefit highlights. Medicare Part D overview. PDP, standalone prescription drug plan, provides drug coverage only. MAPD, Medicare Advantage plus prescription drug, provides medical and drug coverage. Members select and enroll in plans annually. Open enrollment October to December. Monthly premiums paid to plan. Medicare Part D late enrollment penalty. Calculated by multiplying 1% of the national base beneficiary premium, $32.42 in 2014, times the number of full uncovered months that a beneficiary was eligible but didn't sign up for Part D. National base premium may increase each year and penalty may concurrently increase. Extra health beneficiaries do not need to pay penalties. Medicare Part D formulary. CMS set guidelines. Formulary must cover beneficiaries in both community and long-term care settings. Minimum coverage criteria. 2 drugs per therapeutic category class based on USP or other model formulary. Majority of drugs in 6 key classes are covered: antidepressants, antipsychotics, anticonvulsants, antitrovial, immunosuppressants, antineoplastics. Some drug classes are specifically excluded. Per CMS, the following drug classes are excluded from coverage under Part D: OTC, Part B drugs. Excluded drug categories: weight loss, weight gain, fertility agents, agents for cosmetic purposes or hair growth, agents for symptomatic relief of coughs and colds, prescription vitamins and minerals, except prenatal and fluoride preparations, erectile dysfunction, barbiturates, benzodiazepines. Enhanced plan can provide additional coverage for select barbiturates and benzodiazepines. Drug formularies are specific to each plan, i.e., coverage will vary from plan to plan. Co-payment or co-insurance set by each plan. Restrictions on coverage set by plan. Prior authorization, PA. Step therapy, ST. Quantity limits, QL. Upcoming drug maintenance and negative formulary changes. CMS requires 60-day member notification. Includes PA, QL, and ST notification. Medicare Part D 2015 standard benefit limits. Members responsible for monthly premium set by plan, annual deductible, health plan drug coverage, copay co-insurance set by plan. Initial coverage or total drug cost, TDS, of $2,960 set by CMS, made up of deductible, cost share, allowed drug amount. Once TDS is met, member falls into coverage gap where member pays 45% of plan's costs for brand name drugs. Coverage gap. Member responsible for 45% of approved costs for brand drugs and 65% of approved costs for generic drugs. Member continues to pay out of pocket until true out of pocket, TROOP, reaches $4,700 set by CMS. Deductible, cost share, and member spend in coverage gap all contribute to TROOP. Once TROOP is met, member falls into catastrophic coverage where member pays greater of 5% or $2.60 generic or $6.50 brand. Medicare Part D low income. Dual eligible, Medicaid beneficiaries eligible for Medicare. Social Security, extra health or supplemental Social Security. 2015, copay no more than $2.65 generic, $6.60 brand. Medicare Part D explanation of benefits, EOB. Part D members receive a monthly EOB which allows members to monitor their benefit status. Provides monthly claim details. Total drug spent. Total true out-of-pocket, TROOP. Negative drug formulary changes. Medicare Part D, drug plan coverage rules. Prior authorization. Patient and/or prescriber must contact plan before certain prescriptions can be filled, determined by the plans. Quantity limits. Limits on how much medication may be obtained at a time. Step therapy. Plans may require patients to try lower costs or similar drugs before covering prescribed drug. Medicare Part D coverage. Commercial vaccines not covered under Part B when medically necessary to cover illness. Outpatient ED settings. Plan may cover certain drugs not covered under Part B. Medicare Part D additional resources. CMS.gov, Centers for Medicaid and Medicare Services. Medicare.gov, official U.S. government site for Medicare. Compare health and drug plans.
Contact Copeland Insurance Group today to review your options.